Did you know that as of the 2021 CDC data, nearly 1.1 million people were living with HIV in the United States? More than half of them, 53%, were aged 50 and over. Imagine a resilient community where age is celebrated, health is prioritized, and stories of triumph echo through the corridors of time. In a world grappling with HIV and AIDS, older adults stand as unsung heroes, navigating a unique journey of aging while confronting the complexities of this persistent health challenge. Welcome to Aging Together, a podcast dedicated to exploring the challenges and opportunities of caring for our aging loved ones. This podcast is a product of Caregiver Consulting and Healthy Solutions, a private consulting practice dedicated to helping you navigate the aging process with ease. Together, we will dive into a wide range of topics, including health and wellness, financial planning, caregiving, and more. This podcast is for everyone, whether you are an older adult looking to age in place, a caregiver seeking support and guidance, a young or middle-aged adult planning for the future, or simply someone interested in learning more about the aging process. I hope you'll join me on this journey. Let's navigate aging together. What's up, everyone? I'm your host, Pooja, and you're listening to Aging Together. December is World AIDS Awareness Month. While the face of the AIDS epidemic has evolved over the years, the challenges faced by older adults living with this condition remain significant. As advocates for health and wellness, it's imperative to recognize the unique intersection of aging and HIV/AIDS, addressing the needs and concerns of this demographic. In this episode, I review the history and significance of World AIDS Awareness Month, its relevance to our aging population, challenges faced by older adults living with AIDS, and strategies for health and wellness for those individuals. World AIDS Awareness Month emerged from the broader historical context of the HIV/AIDS epidemic that gained prominence in the late 20th century. The global response to this health crisis led to the establishment of various initiatives, including the designation of World AIDS Awareness Month. It is essential to understand the origins and significance of this observance. The inception of World AIDS Awareness Month can be traced back to the earliest days of the HIV/AIDS pandemic. In 1988, two significant events occurred that set the stage for raising awareness and mobilizing efforts against HIV and AIDS. First, the World Health Organization declared December 1st as World AIDS Day, a global observance dedicated to raising awareness about the HIV and AIDS pandemic. This declaration aimed to unite people worldwide in the fight against HIV/AIDS, show support for those living with the virus, and commemorate those who lost their lives due to AIDS-related illnesses. Additionally, around the same time, the United States government also recognized December as AIDS Awareness Month. President Ronald Reagan signed Proclamation 5928 in 1988, designating December as National AIDS Awareness Month, marking a significant step in acknowledging the impact of the epidemic on American society and emphasizing the importance of education, prevention, and support for individuals affected by HIV and AIDS. World AIDS Awareness Month holds immense historical significance as it marks a period dedicated to honoring the memories of those lost to AIDS-related illnesses while advocating for continued progress in prevention, treatment, and support services. It serves as a platform to highlight achievements in medical advancements, community support, and global solidarity in the ongoing battle against HIV and AIDS. Throughout December, communities worldwide engage in activities, events, educational campaigns, and fundraising efforts to further the fight against HIV/AIDS, fostering a united front in the quest to eliminate stigma, prevent new infections, and ensure access to comprehensive care for all affected individuals. In recent decades, medical breakthroughs have transformed HIV/AIDS from a once debilitating illness into a manageable chronic condition. However, this progress poses a unique set of challenges for the aging population living with HIV/AIDS. Contrary to common belief, this demographic faces complex healthcare needs that extend beyond the management of the virus itself. As stated by the Centers for Disease Control and Prevention, the CDC, individuals aged 50 and above constitute a significant portion of those living with HIV/AIDS in the United States. The intersection of aging and HIV/AIDS creates a multifaceted landscape, demanding attention to various aspects, including the management of multiple health conditions that commonly accompany aging, social isolation, mental health concerns, and age-related complications. The confluence of aging and HIV/AIDS presents healthcare providers with a nuanced set of challenges as well. As individuals age, they often contend with a myriad of health issues, such as cardiovascular problems, diabetes, and cognitive decline. When HIV/AIDS is added to this equation, managing multiple conditions simultaneously becomes intricate. Moreover, older adults living with HIV/AIDS face social isolation due to stigma and misconceptions surrounding the virus. Mental health concerns, including depression and anxiety, often prevail among this demographic due to the emotional toll of living with a chronic condition. Addressing these multifaceted needs requires a comprehensive healthcare approach that not only focuses on medical treatments, but also emphasizes mental well-being, social support, and management of age-related complications. Recent studies highlight a concerning trend: the increasing prevalence of HIV/AIDS among older adults. Data compiled by the CDC reveals a substantial rise in the number of new HIV diagnoses among individuals aged 50 and older, accounting for approximately 17% of all new cases in the United States. This surge in diagnoses emphasizes the urgent need for tailored healthcare services and robust support systems specifically designed to meet the unique needs of older adults living with HIV/AIDS. Furthermore, this trend isn't restricted to the United States alone. It's a global phenomenon. The escalating prevalence of HIV/AIDS among older adults on a global scale underscores the necessity for healthcare systems worldwide to adapt and develop specialized services catering to this growing demographic. Understanding these statistics isn't just about recognizing numbers. It's about acknowledging the pressing need to adapt healthcare strategies to address the evolving landscape of HIV/AIDS among older adults. By recognizing this growing prevalence, policymakers, healthcare providers, and communities can collaboratively work to implement effective interventions, develop specialized care models, and enhance support systems tailored to the unique needs of older adults living with HIV/AIDS. Living with HIV and AIDS as you get older can be tough. There are 3 big challenges these older adults may face: taking care of their health, dealing with how people see them, and getting the right care and help. These challenges can make life harder for those with HIV/AIDS as they grow older. Let's address these 3 areas. Health management. Growing older while managing HIV and AIDS brings more challenges, especially when other health issues like heart problems, diabetes, or memory loss come into play. Handling medications for HIV alongside those for other conditions needs extra attention. Sometimes these drugs can affect each other, making it vital to monitor them closely. It becomes a balancing act to ensure that treating one condition doesn't make the other condition worse. For instance, medications for other health problems might interact with HIV medications, affecting their effectiveness or causing side effects. Thus, careful supervision and coordination are crucial to maintain overall health. Additionally, aging can sometimes make it harder for the body to fight HIV or cope with its effects. This means that healthcare providers need to be extra vigilant in managing the condition, adjusting medications, and monitoring overall health to prevent complications. Proper management involves not only medication, but also lifestyle changes, regular checkups, and a focus on mental health to ensure a good quality of life. Moving into social stigma and isolation, older adults with HIV/AIDS often face stigma due to people not understanding the condition well. Misconceptions about who can get HIV and how it spreads might lead to unfair treatment or isolation. Seniors living with HIV/AIDS might feel lonely or cut off from others because they fear being judged or treated differently. This isolation can deeply affect their mental health and their overall well-being. Feeling alone or rejected can make managing their health even harder. Moreover, there's a lack of awareness about how HIV/AIDS affects older adults specifically. This lack of understanding can lead to discrimination or uncomfortable situations, making it tough for older individuals to talk openly about their condition. Erasing this stigma involves educating others, promoting empathy, and raising awareness about HIV/AIDS among older adults. By building understanding and support, we can create a more inclusive environment that helps seniors feel accepted and supported. And finally, access to care and support. Older adults with HIV/AIDS might face barriers when trying to get the care they need. Limited resources, financial constraints, or living in areas without specialized services can make it hard to access proper health care. Sometimes there might not be enough healthcare providers who understand the needs of older adults specifically with HIV/AIDS, leading to gaps in care. Financial struggles or lack of insurance might also prevent them from getting the medications or services they require, affecting their overall well-being. Furthermore, as individuals age, they might need more assistance, especially if their health condition demands extra attention. Unfortunately, these extra needs might not always be met due to the lack of appropriate support services. Overcoming these barriers involves ensuring that healthcare services are available and accessible to older adults with HIV and AIDS. It requires initiatives to address financial hurdles, improve access to specialized care, and create a supportive environment that caters to their unique needs. Helping older adults with HIV/AIDS stay healthy involves a few important strategies. First, we need to look at their health from all angles, not just the medical side. Second, spreading knowledge and awareness can fight misunderstandings and encourage testing. And lastly, creating groups and programs where they can find support and friendship is crucial for their well-being. Let's take a look at each of these areas. First, a holistic care approach. For older adults living with HIV/AIDS, taking care of their health goes beyond just medical treatments. It involves looking at their overall well-being, including their mental and emotional health, social connections, and support systems. A holistic approach to healthcare means considering all these aspects together. For instance, managing stress and mental health can impact how the body responds to HIV and its treatments. By addressing psychological and emotional needs through counseling or support groups, healthcare providers can enhance the overall health outcomes of older adults with HIV or AIDS. Moreover, supporting their social connections and providing a sense of belonging can positively impact their motivation to adhere to treatment plans, leading to better health outcomes. A holistic approach also means involving the patient in decision-making about their care. Older adults with HIV/AIDS should be active participants in their treatment plans. This involves not just understanding their medical needs, but also considering their values, preferences, and individual circumstances. By involving them in decision-making, healthcare providers can create more personalized care plans that are better suited to the unique needs and goals of older adults living with HIV/AIDS. Next, education and awareness. Educating older adults and their families about HIV/AIDS is crucial in reducing stigma and fostering a supportive environment. Providing accurate information about how HIV/AIDS spreads, its treatments, and how it affects seniors specifically can dispel myths and misunderstandings. Tailoring educational campaigns to older adults helps them understand the importance of regular testing and seeking early intervention if needed. It empowers them to make informed decisions about their health and encourages them to seek proper care. Raising awareness about HIV and AIDS among older adults can also foster empathy and understanding within communities. By promoting open discussions and sharing stories of resilience and hope, education and awareness campaigns can create an environment that supports older adults living with HIV/AIDS. It encourages a more inclusive and accepting community that values and respects the experiences of individuals facing this condition in their later years. And finally, support networks and community engagement. Establishing support networks and community programs specifically designed for older adults with HIV/AIDS plays a crucial role in enhancing their quality of life. These programs provide a safe space where individuals can share their experiences, seek advice, and receive emotional support. Such networks also offer resources and information about available services and assistance, helping older adults navigate their healthcare needs more effectively. More so, these networks often organize social activities and events, fostering opportunities for seniors living with HIV/AIDS to connect with others, reducing feelings of isolation, and improving their mental well-being. Community engagement initiatives aimed at involving older adults with HIV/AIDS in various activities and advocacy efforts not only provide a sense of purpose, but also combat social isolation. By engaging in volunteer work, advocacy campaigns, or support groups, individuals feel more connected and valued within their communities. This engagement promotes a sense of belonging and empowers older adults living with HIV and AIDS to lead fulfilling lives while managing their health condition. World AIDS Awareness Month serves as a poignant reminder to address the multifaceted challenges faced by older adults aging with HIV and AIDS. By fostering awareness, advocating for comprehensive care, and fostering inclusive communities, we can empower older adults to navigate their journey with HIV/AIDS while prioritizing their health and well-being in their golden years. Let us stand together in solidarity, ensuring that no one is left behind in the pursuit of health equity and support for those living with HIV/AIDS, regardless of their age. At Caregiver Consulting and Healthy Solutions, we are dedicated to helping you navigate aging together. Thanks for tuning in, and I'll see you next time.